Neck and back pain during the holidays. Yeah, this happens. Unfortunately, this might be coming a little bit late to some of you, and I apologize for that, but maybe we can catch some of you before this happens and prevent some neck and back pain. I see this every year, and I've been meaning to do this video for a while. So what happens during the holidays? What's different? We tend to be in different positions for long periods of time. We tend to be doing odd things that are not typical for us around the house, as we're doing decorations and gifts and boxes and storage and so forth, and we tend to do more lifting and reaching, right? So then we have to have some new medical diagnoses for these situations, and this has already happened. I've already seen this in my chiropractic office in Woburn, Massachusetts this year. We're cutting this show right now in mid-December of 2020, and we're already seeing this. So the diagnoses I'm coming up with is Wrappingitis, as in gift wrapping, Wrappingitis, Cardsitis, sitting down and doing holiday cards, Decorationsitis, right? Cookingitis and Cleaningitis, that absolutely happens now, and Shoppingitis, that just happened, okay? So Wrappingitis happened to one patient, already said it, and more of these will be coming in, unfortunately, this year. They were bent over a table and doing some wrapping for a while, and actually, usually that causes low back pain, which is common, but in this case, it was head and neck pain, again, from having the head down for a couple of hours in a bad position. Cardsitis is obvious, sitting at a desk or whatever, writing cards for a few hours. I had a woman that I'm already working on with neck pain that was ongoing from a car accident, and that flared it up. Not terrible, but it did flare it up, and so I wanted to touch on that. Decorationsitis, this has happened already several times this season, is you're going and getting the decorations out of the attic in the boxes that are way too big, too heavy, too bulky to handle, and we're getting them in bad positions or in the garage, tucked away, and we're grabbing and reaching and yanking and pulling. Never mind after that, then we're reaching into the boxes and pulling out decorations all around the yard, all inside and outside, and then if you're doing the tree thing, and then you're reaching and so on and so forth, right? Particularly the decorations outside, and those are becoming more and more prominent, and people are out there, again, reaching in different positions and underweight and so forth. Cookingitis, we're standing in front of the sink or countertop or stove with a slight bend. I've talked about this for decades, and I learned this for myself over 35 years ago, working as a dishwasher like this, and my back was hurting, so I figured out if I spread my feet apart and I'm more upright, there we go, so we call that the spread eagle special. Again, if you're standing in front of the stove top or the countertop, spread your legs apart so you're not leaning forward at the back like this as much, and there you go. Cleaningitis, of course, the longer you clean in bad positions, it's going to cause more trouble. So, pain prevention, what do you do with the wrapping? The wrapping, of course, is changing positions. Some people will wrap on the floor for a couple of hours, and then they get up and they're crippled, back pain-wise. The one I gave you earlier was heads down, doing this kind of stuff for 2 or 3 hours. So again, changing the position frequently is going to help you. Cards is the same thing. Doing them all at once without moving is going to be the problem, so we have to change those positions and interrupt that. More on that in just a moment. Decorations, instead of just crushing at it all day, doing a 4 or 6 or 8 hour decoration marathon, and then you're busted up after that, you've got to spread it out and break it up and so forth. Cooking and cleaning, same thing. We gave you the cooking position that will change things up. Cleaning, try to break it up in stages instead of all on one day. And the Shoppingitis one, Shoppingitis is being on your feet, and it's the slow walk. So I call this actually, I call this the museum shuffle, and then I also added in the shopping shuffle, okay? So I've used this many, many times. I've talked to hundreds of people about this. Let's say we go to the museum, and we walk a little and stop, and walk a little and stop, and we do that for 3 hours. I can tell you right now, my back will ache. It won't be terrible, but it will ache and bother me, and I can't wait to go and do some stretches, get off my feet, or whatever it is, okay? taking that same 3 hours, let's say we went for a 3-hour walk at speed on a trail. My back would feel fantastic. Do you follow? Because the walking at speed is keeping my spine moving, keeping the body going, getting that mechanoreceptive input and so on and so forth. My back is fabulous. I could walk 6 hours, back is fabulous. But the slow walking shuffle, I hurt. Happened to a couple of patients of mine over the weekend. They went for an extended shopping situation. And I said, obviously they had a flare-up of back pain. What happened? And I dug into it and found out that they were shopping. They said, I didn't understand. I was on my feet and my back was hurting. And I gave them the example of the museum shuffle or the shopping shuffle. That's the difference. Slow movements, standing, or the walking along prevents that problem. So again, you need to take breaks. And I actually gave them the example. An hour in, take a break, sit and do some of the stretches that they learned. 2 hours into the shopping, 3 hours in, and so forth. Okay. So how do we do the ultimate in prevention? I've alluded to that somewhat already. But let's step up your game. Let's do your spine stretches every morning and every night. Now, I often will ask, and I've had thousands and thousands of patients now, if they haven't come to see me for a while and they come in a flare-up, I said, have you been doing your stretches on a regular basis? Unfortunately, a lot of people say no, so I say, let's step up our game and do that 1.5 minutes of stretches in the morning, 1.5 minutes of stretches at night. I've done it on this program here. If you miss those stretches, go to the YouTube page. It's all plastered all over that. Set an alert on your phone. This is so easy and so effective. Now, I know some of you have your watches that can do this as well. If you pay attention to your watch, and it vibrates, and it says, get up and move, you have to listen to it. For a lot of you, setting an alarm on your phone, a countdown timer on your phone that will go off. If you're doing the wrapping thing, if you're doing the cards thing, if you're doing the decorating thing, the cooking thing, the cleaning thing, extended marathons of this, set your phone with a countdown timer of 30 minutes so you'll get up and move and stretch for 30 seconds. 30-second break every 30 minutes. 30-second break every 30 minutes to get yourself out of the positions on the floor, at the desk, bending over the stove, whatever it is. 30 seconds every 30 minutes. Try to take these stretching and moving breaks before you hurt, right? You don't wrap for 2 hours and then say, oh, my back is hurting, and get up and stretch. You've already lost the ground. You've lost that game there. So try to stay ahead of it with that countdown timer activity. And of course, even though you're busier during the holiday season, a lot of my patients have figured out I'm busy and I can't get into the chiropractic office for my chiropractic wellness and prevention visits, but they make it happen anyways. They're like, I have to do this. It's kind of like the person that's traveling or going on vacation and the time is really tight, but they make sure that they get in, get their spine checked, get their nervous system worked on, and so forth. That's the ultimate in prevention to preventing neck and back pain during the holidays. I'm Dr. Scott Fuller.